With depression, and maybe you can explain, are there different forms of depression? Are there some types of depression where it's normal? Are there types where you need to be seeing somebody? And I know you said you're a psychotherapist. Are there forms where, how do you know when you need medication for it and not just therapy alone?
Well, there's, when you talk about, depression, more into, I don't say illness, I don't like that word, but depression that is a chemical imbalance or is beyond just a trauma, beyond just a normal or temporary dip into depression, when you really suck and your brain's not working right, the chemical balance, hormonal balance, health issues can set us back, and that's when you need to primarily start with your family doctor and then see a psychiatrist. The difference between a psychiatrist and a psychologist, psychotherapist is a psychiatrist can prescribe medication as needed for more serious mental illness.
Okay.
So very few people that come into therapy are really mentally ill because they don't have that kind of self-awareness to want to seek out therapy. But because they're depressed or on medication doesn't mean they're mental illness. That's a whole separate category. It means they're struggling, and the depression's so overwhelming that it's starting to change how the brain works. And that's when medication can help a little bit. The ideal treatment is a combination of talk therapy and medication if the depression or anxiety is that bad. Maybe to ask your question more straightforward, if your depression or anxiety, OCD, more severe mental health symptoms and issues that are interfering with your ability to function normally in your life, medication can help.
Got it.
Medication can make those symptoms a little less intense so that we can work on what some of the underlying issues are. Did that babbled a bit? Did that make sense?
No, it did.
Okay,
it did. How do you feel about people who go on the internet and, like they're trying to understand what's going on in their life and, they type in signs of depression. Do you feel that that's okay to do research on your own
Absolutely.
Or as a therapist, being trained, are you scared of sometimes the things the web can tell potential clients or the public?
Not necessarily in my field. I would be if I were strictly in the field of medicine.
Yeah, that's what I was going to say.
If, a medical doctor and I look up, I've got an injured toe and I think I have diabetes or whatever. I mean, no, not for medical reasons. Never. I don't rely on the web or trust the web at all. But when we're dealing with something as diverse and personal as human nature and our own personal suffering, to look on the internet and go, oh, do I ever? It gets us thinking. Do you ever feel, do you not get out of bed? Do you have trouble with, sexual relationships, with personal relationships? Are you yelling too much at your kids? Are you, so anxious you can't, go out the front door? If we see those as questions, leading to some inquiry about what's going on, I think they're really helpful. If it then leads to a definitive diagnosis, no, I don't think so.
Yeah.
But as far as, looking up, what are the signs of depression? I think it's helpful. How do I know if I have PTSD? So if we look at those questions as kind of an inner dialogue, hey, am I, stuck here? Is this, good? I think it can be helpful.
Yeah. Speaking of PTSD, a lot of people go through traumatic events in life and sometimes can experience PTSD and not even know it. What are some signs of PTSD and when do you need help for it? So there is a normal PTSD, post-shock period for anybody that experiences a traumatic event. Somebody swerves in front of you, you slam on the brakes, and for 10 minutes you're shaking. That's a little PTSD. Okay, or you see something horrific, death of somebody or an assault or a bomb dropping. It's normal to have post-trauma stress feelings, post-trauma feelings. Okay, it's not a disorder, it's normal, and depending on the severity of the traumatic event we experience, that post-trauma feeling or stage can last a couple of months, a few months, up to a year. That's normal. And during that period of post-trauma, we need a lot of support. We need to take care of our physical self. We need to reach out to other people. We need to talk about it.
We need to feel like we're not alone with it. We need a lot of me too. Did you see that too? Did you see what just happened? So that in the community, sharing that is super helpful.
Yeah.
When do we need help with it? When the symptoms of it, the flight or fight or freeze moment, or the inability to talk about it, or the loss of appetite, when it's starting to interfere with our health, when we're ending up more depressed than not, when it's past normal grieving into debilitating depression, when we're stuck with it, that's a time to have some help with it. And I think through the process of dealing with post-trauma, any point is healthy to have a therapist help you process through it. But for sure, absolutely, we need more professional help when we really get stuck with it, because that's when it becomes post-traumatic stress disorder. It's a disordered response, or disorder so much as it's interfering with our life way beyond what we think a normal stress reaction would be like.
Yeah.